Anjali Poojary. I'll be presenting a paper on clinicopathological profile of salivary gland lesions in a tertiary care hospital. It's a cross-sectional study. Salivary gland lesions are relatively uncommon lesions, accounting for 3 to 6% of all head and neck neoplasms. The World Health Organization has given a global incidence of salivary gland tumors as 0.4 to 13.5 cases per 1 lakh population annually. Majority of salivary gland tumors show female preponderance. The mean age of presentation of malignant salivary neoplasms is 55 to 65 years, while benign is typically the last at least a decade earlier. That's the mean age is about 45 years. Parotid gland is the most commonly affected salivary gland, accounts for about 70 to 85% of tumors. The main aim and objective of this study was to determine the demographic data, clinical presentations and investigations and management, and to study the clinicopathological profile of salivary gland lesions in a tertiary care hospital. This study is a cross-sectional study carried out in the Department of Otorhinolaryngology at a tertiary care hospital for a period of 1 year. 21 subjects were included in the study. Keeping the inclusion and the exclusion criteria in the mind, patients with congenital and acute inflammatory salivary gland lesions or secondary systemic disease were excluded from this study. Here are some images of the patients and their intraoperative findings. Observations and results. As we can see, the maximum number of cases were observed in the age group of 21 to 30 years, followed by 30 to 40 years. Minimum patients were observed in the age group of 51 to 60 years. In this study, we can see that maximum number of patients were females, that is 13, accounting for about 61 to 0.9%, and then were males, compared to males, which were 38.09%. The male to female ratio is 0.6 to 1%, 0.6 to 1, and male to female ratio in case of malignancy is 2:1. We can also see that the benign lesions account for about 85% of the total tumors, while the malignant tumors account for about 15%. The site-wise distribution pattern in salivary gland lesions based on the USG and the FNAC findings. Parotid gland was the commonest gland involved, accounting for about 12 cases, which is 57%, followed by submandibular gland, and then the minor salivary gland. Based on the histopathological diagnosis of benign salivary gland, we can see that pleomorphic adenoma of the parotid gland was the commonest gland involved, followed by the Warthin's tumor. Then coming to the malignant salivary glands, histopathological diagnosis of malignant salivary glands, mucoepidermoid carcinoma of the parotid was the commonest gland. We also observed adenocystic carcinoma in the submandibular gland. Discussion. So in the present study, the highest percentage of patients were seen in the age group of 41 to 50 years. Similarly, according to Rajdev et al., also found majority of patients in the same age group. A male to female ratio was 1:1.8. Higher proportion was seen in case of females. Benign tumors accounted for about 62%, which is more common as compared to 38%. Parotid was the most frequently affected sites, accounting for about 65.6% cases, followed by submandibular and then the minor salivary gland. These findings were consistent with those reported in Devi et al. And Shinde et al. Histopathological analysis showed that pleomorphic adenoma was the most prevalent benign tumor, accounting for 75% of cases, with Warthin's tumor followed by Warthin's tumor. Among the malignant salivary gland tumors, mucoepidermoid carcinoma was the most commonly observed tumor, presenting for about 33.35% cases. FNAC was done in all cases before surgery. In case of parotid gland tumor, superficial parotidectomy was done with facial nerve dissection and preservation, which is the standard procedure for benign or small malignant tumors limited to superficial lobe of the gland. Here are some studies which were similar to my present study. Concluding, the present study concludes that the clinical characteristics alone are insufficient for a definitive diagnosis of salivary gland tumors. Preoperative evaluation through FNAC and histopathological examination following surgery are essential for accurate diagnosis and effective management. Parotid is the most commonly affected salivary gland with pleomorphic adenoma as the commonest lesion. Mucoepidermoid carcinoma was the most common malignant tumor observed with a predilection for minor salivary glands. That's it. Thank you. Thank you so much.
Which is the contraindication for tumor or lesion for FNAC?
Contraindication.
This is something.
Yes, yes, sir.
Seedling.
Yes. Thank you, sir.
Now I request our second chairperson, Dr. Vijay Kumar Kendri, to hand over the certificate to Dr. Anjali. थोडं त्या साईडला सर स्क्रीनवर. नेक्स्ट डॉक्टर सॅली होगाडे.